I personally think that stigmatization comes from insecurity, and that is why many people do some kind of an eggshell walking.
You're saying that it is normal to have mental health problems, which is the opposite of what I think many people think of as normal people. They're fine. Normal people don't struggle. Welcome to Thought Report, and a warm welcome to my guest. Molen Ram is a psychologist, and she's the co-host of a YouTube channel called No Stigma. Thank you so much for taking the time to talk to me.
Thanks for the invitation. Hi.
We want to talk about stigma around mental health, you know, those negative attitudes, negative beliefs that we might have when it comes to mental health conditions. You host a show called No Stigma. Can you tell us a bit about what that term means for you?
So stigma is a negative attribute about a mental illness. So many patients tell me that they suffer from stigmatization, like, for example, friends. They break off the contact when they know about the mental illness. We try to give a realistic perspective on how people who are affected by mental illnesses live and how they developed their mental illnesses, how their everyday life looks like, what they struggle with every day, and how they experience the world.
On your show, your team interviews a variety of people with different mental health conditions, problems. What are some of the things that they have told you when it comes to stigma, how that affects them?
For instance, we had a protagonist on the episode about schizophrenia. His name is Max, and Max told us that, he told his friends about the diagnosis, and they broke off contact because they thought he's going to be dangerous or that he's violent and stuff like that. And that is a huge problem, especially with the diagnoses that are more severe. For instance, schizophrenia or borderline personality disorder or bipolar disorder, like these are the patients that are affected very badly and they suffer a lot. And with the stigmatization, there's another level of suffering, so to say.
Can you maybe tell us a little bit about the misconceptions then around conditions like borderline or schizophrenia?
People with schizophrenia are assumed to be violent or somehow dangerous, which is actually not true. I mean, if you suffer from this, it's a mental illness where you have, for example, voices in your head, and where some people feel like they're pursued by an enemy somehow, and that's very, very, very horrible for them. So it can happen that people, out of this fear, that they somehow, start to attack others. But when they already know about the diagnosis and when they talk about that to people, they mostly, like, in a better condition, they got their medication, they got psychotherapy, and that is why this is such a bad prejudice, for instance. Another thing is, for example, borderline personality disorder. These are people that are suffering from, like, lots of ups and downs in their mood. For example, sometimes they're totally euphoric, and then they feel really bad, and they tend to do self-harming behavior, for instance, cutting themselves, or they are very suicidal, just to name a few points. And people normally say that they're evil, that you should stay away from them because it's like toxic if you have some person of that in your environment, or that these people are manipulative, or they just want attention. And these are another few prejudices.
In your experience, that prejudice is not right?
It's not. And I think it's about getting into the perspective of the patients. And that's what we try to do with No Stigma, because we have like this part of the episode where our reporter, Alex, is going somewhere with the patients and just let them tell him about their sicknesses and how they suffer from it. And if you know that, for instance, in borderline patients, that these ups and downs are some kind of a symptom, and this is actually part of the illness, then you know that these people are not evil. They're just suffering from it, you know?
Maybe we can talk a little bit about the kind of spectrum of mental health.
Mm-hmm.
When we talk about things like, for example, borderline or schizophrenia, is there a scale of mental health issues? People who have, depression because, maybe they are mourning someone they lost, or people who suffer from anxiety. Is there a scale of severity of mental health issues?
Yes, there is. In Germany, we have this diagnosis manual. It's called ICD-10. And for some diagnosis, you can give like a degree of severity. You can say it's a mild depression, for instance, it's moderate or it's severe.
When we talk about mental health, is there such a thing as normal? I had a therapist once who didn't really listen to my problems because he kept saying that, oh no, that's normal.
Mm-hmm.
That's normal. You're normal. Is there such a thing as normal?
That's an interesting point that you're addressing, because from my perspective, I would say definitely, and we're much more normal than we tend to think. And this is very interesting because it's due to the huge debate about destigmatizing diagnosis. Because the more you talk about these categories, for instance, depression or anxiety disorder, the less precisely these terms are defined. For instance, if you have anxiety, we all have anxieties. And I think it's very good that we more and more learn to talk about it and to talk about negative feelings and stuff like that. But the problem is that this topic is very present on social media, for instance. And then people tend to think, okay, my anxieties are pathological when they're actually not. And that they are very strictly defined criteria about if something's pathological or not. And the problem is when you give yourself the label of, oh, I don't only have anxieties, I have an anxiety disorder. That means that the prognosis is much worse than when you say, okay, it's just an anxiety. I can try to overcome it. I can try to live with it. You know what I mean? There are these labels for a reason, and it's very, very good that more and more people seek for help. But sometimes you have some kind of a paradox effect about destigmatization, because when people start to diagnose themselves on social media, the prognosis is getting worse and worse.
That's an interesting point you bring up there. Do you then encounter people who either think their problems actually are bigger than they are, or people who, don't think their issues are bad enough to seek help?
It's a fine line. It's very hard to educate about mental illnesses without giving the impression that every major life problem is pathological. And it's a really fine line that we try to walk with this format, because there are people that have the self-stigmatization, that think, okay, I'm definitely not going to a psychotherapist because then he will tell me I'm depressed, and I'm not, because I think depressed people are lazy. And there are these people, but at the same time, especially people who are a little bit younger, they know a lot about the more mild psychiatric illnesses, and they sometimes tend to overinterpret bad phases and anxieties. And of course, you always have to see the individual. And that is why it's good if you seek help of a professional, because he will know whether your anxiety is pathological or not.
What's in that word pathological? Can you just explain that to us?
So according to the diagnosis criteria, pathological is if you suffer from these symptoms and if you have a functional impairment. For instance, you can have really strange perceptions and anything. If you don't suffer from it, it's not an illness by the criteria. And that's very, very important. For example, if you look at ADHD, there are people that have ADHD symptoms. Maybe they would fulfill the criteria, but they don't suffer from it. And then it is not a pathological thing. You know what I mean? And the problem with psychiatric illnesses is that we don't have, for example, blood measures as we have in somatic illnesses. And that's why, obviously there is criteria. And of course, people can Google this. And when they sit in front of me and tell me all the symptoms, I will give them the diagnosis. And I really don't want to say that people are faking this, not at all. I think it's very good that people have the tendency to seek for professional help more and more. But it's not too easy to find the balance between providing help for people when it's absolutely necessary and to not make bad faces in life bigger than they actually are.
Can that also be part of stigmatization, though, of mental health conditions? If, say someone who is diagnosed with ADHD continuously hear from, friends or from parents, for example, everyone has ADHD these days, that kind of attitude, because some of these conditions are so prevalent now in social media, for example, there is a tendency to kind of tell people, no, you don't have it. You've just watched too many TikToks.
Yeah. Yeah. And that is the problem that causes out of this awareness that we have for some mental illnesses. And I always want to or try to make people understand that you have to differentiate between people with very mild symptoms and people with severe symptoms. And there are people with ADHD that suffer a lot from that have made so many bad experiences throughout their whole lives because they have ADHD, because they had conflicts with teachers at school, at the workplace, with friends and family. And there are people that have a really huge suffering from that. And these people don't feel seen when the surrounding or the peer group says, but ADHD, everybody has it. You know what I mean?
A lot of mental health stigma has to do, or internalized mental health stigma kind of comes out in workplaces and in, universities and schools, because we might not want to disclose to our employers certain things. Do you think workplaces in Germany are doing enough to combat that?
That's a difficult question to ask for me because I'm working in a hospital. I think that there are many interventions that are done to, for example, provide people from getting a burnout. Like burnout is not a pathological syndrome; it's a term for an exhaustion and a depression out of exhaustion. And I think there are many things that are done, and I think that companies have understood that mental health is actually bad for the economy, because there are so many people on sick leave for such a long time because they struggle with their mental health. And I think many companies have understood that, and they have some kind of prevention programs. And I think we're actually on a good way when it comes to that.
Let's talk a little bit more about your YouTube channel. Do you think it works? Does anti-stigma campaigns like yours work?
That's a very interesting question. To be honest, I'm thinking a lot about that, and I read a lot about that because that's something that I want to achieve with this. I want to manage to keep this balance, to destigmatize people who are very, 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 very affected by stigma. For example, you have this severe depression, people that can't get out of bed because it's of symptoms. And every day, if they get out of bed, they do a great job and stuff like that. And I want to make this point, and at the same time, I want to tell people that many more things are normal than they actually think. And if you have anxiety, it doesn't necessarily mean you have an anxiety disorder. And yeah, people suffer, and it's good that you can talk about it, and it's good that you think about it, but you can manage much more than you think.
It's nice what you say about the word normal, because, you're saying that it is normal to have mental health problems, which is kind of the opposite of what I think many people think of as, normal people. They're fine. Normal people don't struggle. It's the abnormal people who have problems. But, as you say, it is normal to struggle with mental health. I just want to talk a little bit about who might be affected more by mental health stigma. From your professional life and from the show, are there any groups that kind of stand out to you? I'm thinking, LGBTQ or specific ethnic groups.
What we witness in the hospital is that in specific ethnic groups or communities, for example, if they have a migration background, mental health issues are more stigmatized than it is in our, I would say, community or our bubble we have here.
Yeah.
And that is why in their cases, they tend to have more physical symptoms. For instance, if you can show your grief, there's people that are super, super, super sad because they're depressed, obviously, but they are very disconnected to their feelings. And what happens then if you suppress this all the time is that people get somatic symptoms. And that is why I somehow have the impression that some of these people tend to get to the hospital because of somatic problems that are actually rooted in mental problems. But again, that's just a personal impression.
Just picking up on what you said about specific ethnic groups, people with immigrant backgrounds in Germany, having a different experience when it comes to mental health. Is there a problem with access to mental health services in Germany, do you think?
Yes, there is, because I think you might have already heard about that we have a lack of outpatient psychotherapists, that they're on health insurance fund. And that is why many, many psychotherapists just treat patients with private health insurance or self-payers. And that creates a huge gap between people who can afford this and not. And at the same time, people with a low socioeconomic status are more eligible to have or to develop a mental illness. And that's something that makes the problem even worse.
Why is that? Are there not enough mental health practitioners in Germany? Why is it so hard for people on public health insurance to get mental health help in Germany?
The thing is, we have enough psychologists from my view, because there's many people that are super interested in that subject. And we have actually enough psychotherapists. The problem is that, that's something that's actually being negotiated politically, that the health insurance is obviously not willing to pay more and more out of these psychotherapies. And I think there's both sides on that topic. On one hand, I really see the problem, and I see even in my private surroundings that there are many, many people who seek for professional help and just can't get it because it takes a year to start an outpatient therapy.
I have personal experience with that. Yeah.
Oh, sorry to hear that. Yeah, and that sucks. And many, many, many people have that problem. On the other hand, we all have to pay health insurance. And if there's more and more psychotherapists that are on health insurance fund, then we will all have to pay more about that. And I think that is something that we have to negotiate politically and as a society. How much are we willing to pay for people to get help? And that is why I always ask for a better distribution system to like match the severity of the illness to the intervention and how much resources the intervention needs, because then we would hopefully not have the problem of so many people seeking for professional help who actually need it and who can't get into the system.
Do you think if there was a better distribution, would that also help with the stigmas? It seems to me that mental health care is, like you said, for someone with a private health insurance or someone who can pay for it themselves. That's the standard, it seems. If the distribution was better, could that also help against stigma?
Good question. I think so, because, for instance, there are self-help groups like Alcoholics Anonymous, which are very low on resources. They don't cost that much, and they are very, very good for long-term cure. For example, if you have been an alcohol addict, for instance, and you went through therapy and stuff like that, then people go for years to the Alcoholics Anonymous, and that helps them to stay sober, which is great. And there are psychotherapy groups, for example. So a psychotherapist is sitting there, but treating up to 12 patients at once. And that is something that you could profit from perfectly, because you can work in a whole different way in a group. And that's another thing that doesn't need that much of resources. Or there are digital health applications, which are evidence-based. So certain apps where they educate you about some kind of symptoms and some kind of mental illness. And that are another good way to match people who have very mild symptoms to get them into initial help. And maybe that's already enough. You know what I mean? And then we would have more capacities for people with moderate or severe symptoms to get help.
Where do you think the conversation around mental health is going now? And, we live in tumultuous time, some might say, politically. How do you see the next, decade when it comes to the conversation around mental health?
What I'm hoping is that we all as a society manage to be more tolerant with each other and to establish some kind of an error culture. And what I mean with error culture is that I personally think that stigmatization comes from insecurity. A certain person has a diagnosis, and most people are actually afraid of doing something wrong. And that is why they keep their distance, because they don't like to experience themselves as incompetent, because that's not good for the self-esteem. And that is why many people do some kind of an eggshell walking around people with mental health issues. And what I'm hoping for is that we establish some kind of an error culture. And I think people who are affected by mental disorders, I think they somehow need to be patient with others. People are sometimes clumsy. People are insensitive sometimes, and that sucks. But mostly they don't do it out of their evilness. They just do it out of insecurity. And I think if we're both a little bit more tolerant with each other and establish some kind of error culture and keep in contact and keep in negotiating these things, I think then we can find a good way.
So do you have hope for the future when it comes to Germany's mental health?
I think it's a little bit of an unpopular opinion, but I think we have a very caring healthcare system. And I see that when I work with the really severely affected patients that I treat at the hospital, many of them are not able to live at home alone anymore. And there are so many possibilities for them to get into a specific treatment or into homes, especially for people with severe mental illnesses. There are so many possibilities to get help. Again, there's a lot of bureaucracy around it, which sucks, but there is a lot of opportunity. And I think our system at least tries to care of all these people. And there's nearly nobody that like falls through the network, we would say in German. And that is actually very, very good. And I think at some point we need to appreciate this, even though there's still a lot of things that need to get better. For example, bureaucracy and long time that we have to wait for help and stuff like that. But again, I think it's both. We have very good structures. And I think compared to other countries, our healthcare system is very caring. But there's a lot of things that still need to be improved.
I think that's a good note to end it on. Yes, we need to improve the German bureaucracy.
Mm-hmm.
Mollen Ram, thank you so much for taking the time to speak to us. Thank you so much for all your valuable insights. If you want to check out Mollen on YouTube, look for No Stigma. It's definitely recommended. Even if you don't speak German, you can watch it with subtitles. It's really good. I wish you all the best with your professional career and with the YouTube platform. Thank you so much for being on the show.
Thank you for having me.